Nicole, thanks so much. Just a reminder to download our 17 News app to receive the latest traffic alerts sent directly to your phone. 17 Newsmakers now, and joining us to talk about the rollout of the coronavirus vaccine is Michelle Corson, the Program Manager and Public Relations Officer for Kern County Public Health. Michelle, thanks so much for joining us this morning.
You're welcome. Good morning.
Good morning. There's a lot of questions out there. People are trying to find out more information about how they can simply sign up and receive a vaccine. The vaccines have been available in Kern County for a very select few people, mainly our first responders and our healthcare workers. But now we have, now those who are 65 and older are now eligible to receive a vaccine as well. And there's a lot of questions on how you go about signing up for an appointment. Can you just kind of break down the process of simply signing up to receive a vaccine?
Absolutely. You know, we are grateful our community is so interested because we want as many people to get vaccinated as soon as possible. We knew, though, that this was going to be a limited distribution at first. That's why we've got these categories that the state has indicated we need to follow for this limited distribution. Beside Kern County Public Health, there are many partners that receive the vaccinations, and they are on their own and scheduling in a variety of ways based upon their allotment. So it's going to vary from location to location. So what we've done at Public Health is we have been working with those partners to get that information, put it on our website, kernpublichealth.com. We have an interactive map that has all the current providers, and when you click on that provider, there's information of how to register and attempt to make an appointment. And so this is kind of something we did to have something in one location. We hear that, you know, some of these locations are getting full because of the high interest, but really coming to our website is the one kind of central location to get that information.
What if we've heard from people who have kind of reached out to us. They're concerned because they don't have a computer. They don't have internet access. So what do those people do instead?
So they absolutely can call us at 321-3000 for information if they are not able to access the internet. We have also been on our social media channels. Again, that's the internet, sort of, but a lot of people just have those phones. We've been printing and publishing a list on a weekly basis to try to kind of have that list view. So calling us at 321-3000 is definitely an option. We are very excited because, you know, we had the soft launch of our fairgrounds mass vaccination site last week. Soft launch only, but we will be announcing hopefully later today how our residents can register for the fairgrounds, because there's been a lot of interest in that. So stay tuned. There's information coming about that to make it as easy and quick as possible for our community.
The coronavirus vaccine has, you have to get 2 shots. There are 2 doses here. Is the second shot guaranteed if you've received the first one? Because I know that there's that window that you have to come back and make an appointment for the second shot. So is that second dose going to be guaranteed?
I think guaranteed is a strong word. What we are being told by the state is to proceed with the first doses, that we're going to, on a regular basis, get those second doses. That's what we've been told, so we fully expect that. The CDC has been clear to stick with those guidelines of getting that second shot, you know, whether it's 2 to 3 weeks following, you know, the Moderna versus the Pfizer, but it can be as long as 6 weeks. That certainly isn't recommended, but there is a window there. So these are things that, you know, we are working through, but the state has assured us that those second doses are going to be coming through, and we hope and expect that to happen.
Right. Okay, I want to go back to the vaccine, the mass distribution side at the fairgrounds, because a lot of people have questions about that right now. I know it is a soft opening, a soft launch, if you will, and you're only giving out just a couple hundred shots a day. At what point, though, do you think that we're going to be able to get to the level of vaccinating thousands of people with the coronavirus vaccine? I know that's far in the future, but is there an approximate timeline that at least is the goal at this point?
You know, the goal is really based on the state's allotment to our county. So it's hard for us to project. We anticipate, we have been told that this is going to continue, and, you know, it's based upon currently our allotment in Kern County is based upon the healthcare population. And so we expect that to shift and start getting vaccines based on different criteria within our county. So much is really based upon that, Alex. So it's hard for us to say.
Right.
All I can tell you is we are gearing up. There is so much work going on at the fairgrounds. We are so excited. All of our county is coming together for this. And, you know, I would hope that reaching that 5,000 a day is going to be, you know, within the next several months. We're ready. We just are waiting on the state.
All right, and finally, I have to ask you, we know who's eligible to receive a vaccine right now. Who is next, and when could we see that next group of people start to become eligible for the vaccine?
That's a great question. You know, the 65 and older came out, and that's part of officially, you know, that 1B, though we are not moving fully into the 1B phase for all those other essential workers. So truly, this is up to the state, and we are eager for that guidance. We know right now, though, we are very full with, you know, just trying to get this priority group vaccinated. I wish I had a firm answer for you, but truly it is up to the state. And according to the current structure, it would be those in education, childcare, emergency services, and food and agriculture would be the rest of that 1B that is seemingly the next step.
All right, well, this is a very fluid situation, as we've heard from all healthcare professionals saying this is, you know, just guidelines really, but it is good to see that, of course, that this is moving forward. And again, thank you so much for joining us this morning to talk more about the vaccines here in Kern County.
Absolutely. Thanks, Alex.
All right, take care, Michelle.
Stay safe.